So I think what I also want to highlight is that in the supervised, there's certainly a lot of elements that supervisees have challenges. So you will see in one of the examples is that there are some useful examples that deals with when the supervisees are not that comfortable, not confident, when they're too superficial, and not taking directions. So those again are examples that you can use to see how that's being done. So in terms of the remedial and due process, what I would say is that as supervisees, we need to document and provide clear feedback and standards. And when hold the university also accountable for in terms of the same standard. And when things are not going well, promptly reach out to the supervisee and provide concrete feedback and apply the standard consistently. And be able to provide immediate goals, recommendations, and remedial actions so that the supervisees can take actions. And making sure that you do provide the recording and the documentation concretely. Towards the end, I do also have some tips for new supervisors. One thing that I would say is that supervision is not an easy task. Make sure that you understand the policies of your organizations. Ask for time so that you can actually learn about your role as a supervisor. Take the time to really know about your supervisees and establish a contractual relationship with the supervisees and be able to help and find training and understanding what procedures and methods that you feel most comfortable with. I think I also want to highlight that it's important to make sure that you find a mentor within your practice, or even it could be external or internal, to really use that as a matter supervision, so that as beginner supervisors, you are able to have yourself in check in whether you're doing the right thing as a supervisor. Shadow a supervisor that you respect and see how they do the work. And constantly ask for feedback. So whether it's from your matter supervisor or from the supervisees, I think it's important to do that. The next slide about tips and summary. I think supervision is an effort that is not, we should not take it lightly. I think we need to be planful and prepared. And it could be as short as duration as attending a seminar for a couple of hours to formalize training that exists in different fields. Understanding the knowledge about the models, styles, expectation, methods of supervision, how to build relationship with your supervisee, and I think those would be important. Using those measures to quantify and have you to understand where you are and where your supervisees are, but also use self-reflection as a way to go deeper in terms of what goes where and what could be improved. The next slide talks about having a secondary supervisor to provide expert consultation. I think it speaks to the fact that, let's say, if I am in a certain kind of training in, let's say, clinical psychology, but my supervisee may have a different training, let's say in rehab psychology. I don't hold that I know everything about a different discipline, but I think delineating that there's something that's common as all psychologists need to know, assessment, psychotherapy, you can serve as the primary supervisor. But if it comes to some content expert that you may feel less comfortable, it could be cultural aspect or certain technique. It's also important to seek expert consultation on that perspective. I also want to emphasize that individual supervision is imperative, because it helps to build rapport and address individual challenges. But I do want to really encourage the audience to think about and take advantage of case conferencing and group seminars. I know as an intern before, I attend a lot of group seminars with other interns, and I see that as really good and as a way that people from different disciplines or different roles, especially if you're working in a multidisciplinary perspective, is that different professionals can provide examples and inform everybody about their role and also the expertise. The last point about as rehab psychologists, I think what we know is that we understand how psychosocial aspects of disability, how environmental aspect and family attributes could affect successful rehab outcome. So being able to provide a seminar and educate others about your expertise and so that everybody is on the same page about what we do, I think it would be helpful in that. In the next slide, the next two slides is really to reiterate who we are as a supervisee. So you will see that in this, the figure 2, if you are a supervisee who are at level 1, that means you are more at the beginning style, that you kind of, the characteristic is that you focus more on yourself and you tend to be more anxious. You may overgeneralize and overuse a scale. In that case, for supervisors, what would be helpful is to provide structure to minimize anxiety and also be supportive and address the strength first and then going with the weakness. Techniques that you can use would be observation, skills training, role playing, reading, group supervision, and closely monitoring clients' outcome. As the supervisee move to a more development level, then I think the characteristic and also the level of skills and techniques could be different. The next slide is more pertaining to supervisor. So if you are at the beginning stage, those are the characteristics of who you are as a supervisor. And I think following a structure, being able to reach out to the system to have support from them and also assign to more beginner counselors would be most helpful as you're learning. But as you are moving towards the higher level, then I think you probably would be very comfortable with supervising at all levels. So I think I apologize, Dr. Hughes, that I insist talking so much about that. But I think what is really left is about the scenario. Do you think that we should stop here, or do you think that there would be room that we can talk a little bit about the scenario?
If you're willing to keep going, let's just keep the recording going. For those of you who have to leave, again, thank you for joining us today. This recording will be posted to the website, so please, good luck as you continue on with your weeks and your other professional duties, but if you care to stay on with us, we certainly welcome that.
Okay, great. So I think in this scenario, it is somebody who is a more senior, a male white supervisor who has expertise in clinical psychology, but he's supervising a younger beginner's level female minority supervisee in her predoctoral internship in counseling and she's getting a degree in counseling psychology. So you can see that this scenario has a lot of differences. In terms of differences in disciplines, age, gender, differences in terms of ethnicity and seniority. And I'm just curious what your thoughts in terms of how this kind of relationship would affect positively or negatively in terms of the supervisory alliance. I know that in the next slide, I provide some tips in terms of what I thought would be useful for the supervisors. But before we go on to that, I'm just curious if any audience would like to kind of take on providing some examples or your So is there any comments or wisdoms from the audience?
For those of you still with us, you can now unmute yourself if you do have questions.
Can you hear me?
Yes, Dr. Lee, can you hear us now?
Yep.
Yes.
So no one has asked a question, but I did want to go back to the Dr. Wright slide here in terms of applications to rehabilitation psychology, just in our final moment here, given that no one else has provided a question or comment regarding the clinical scenario. Was there anything else that you wanted to highlight with regard to the values and principles for rehab?
Well, I think that is actually, yes, I think I was actually excited in finding this, identifying these articles in the last week that we all understand the values of clinical supervision. We all understand as a rehab psychologist about Patrice Wright's values. And so I think it certainly takes more of a psychosocial aspect in understanding the person and infusing the importance of positive values and facilitating growth in the client. And so in this slide, it was directly the table that is really the philosophy, the values and beliefs of Dr. Wright in terms of practicing as a rehab psychologist. And so I would say that we can use similar aspects as working with our supervisees in understanding that there's individual difference, that we need to respect the person as who they are. And there may be limitations that may hinder their learning, but then it is our job to it's our job to empower them so that they will be able to learn. And certainly it would be important that we understand that the process is not just about the knowledge and the competency, but also there's a huge psychological aspect that we need to understand where that's coming from in affecting their successful learning. So I think it certainly speaks a lot about the whole parallel process of us as rehab psychologists. We apply those principles when working with clients with the different types of disabilities. This is not to say that our supervisees are our clients with disability, but I think a lot of the way that we work with clients is really parallel to when we apply that to working with our supervisees.
Absolutely. So thank you again. This wonderful slide you put up on tips for supervisors moving forward, and then just concluding with these additional resources. You referenced the Bernard and Goodyear book several times throughout your presentation today, which I think is an essential, fundamental resource. And thank you again for providing all the links to these various measures that you've recommended. We will be sharing these slides that have the embedded links. So while attendees today were not able to click on their screen to access those links today, they will be able to when we send out the PDF, similarly to what we did for part 1 of this series.
Great. I have one final thing to say. Yes, this slide here, the last one, the one that I bold, I think there would be a lot of utilization for our colleagues here as psychologists, because The one on clinical supervision for psychologists, it does provide some resources where, for those of you who are interested in furthering your understanding about psychology and clinical supervision, you can certainly click onto that so that you can attend their seminar and training. Choice by course, by profession and stay, I think that it's also helpful that if you're at a different stay and different professions, psychologists, social work, and others, it would also allow you to find resources, and you can attend. Probably some would be for a fee, others may be for free, but you could attend and gain CEU. I think one thing I learned is that the marriage and family counseling, they also have a very strong clinical supervision training that's very formalized. That it really spans from attending online classes, doing like a supervision models paper, and then having mandatory supervision hours. It's kind of like a practicum for our students, that they need to be supervised by by senior supervisors, and then there has to be documentation, and that submits to their website where they would approve that the person is at the level where they can provide clinical supervision. So you can see that they also need that to be a process where they need to renew every few years. And so that really speaks to the level of the fact that they have a very well process and training modules that they would allow individuals to do. Now, granted that this is for training specifically on marriage and family counseling, but I would imagine that there would be something that would be similar for psychologists, or even for those of you who are in the different disciplines in psychology, that you would find it useful. So that would be all I would have to say.
Wonderful. Well, thank you again, Dr. Lee, for a wonderful series. This could have easily spread over the course of multiple semesters of coursework. So we appreciate your bringing and consolidating such a wealth of resource into our 2 hours of webinar last week and this week. Thank you all, for those of you who are still on the line and attending. We really appreciate your participation, and we will be disseminating a feedback survey as well. Anyone who would like to provide more qualitative feedback is welcome to do so by email. You can certainly email myself or Dr. Lee, and we will look forward to soliciting interest in topics for our fall webinar series. Again, please feel free to reach out to the Division 22 Early Career Group, and we will be in touch. Thank you very much, and I hope everyone has a wonderful rest of their week.
Thank you.
Bye-bye.
Bye-bye.